So just start to share my screen. Hopefully you can all see that. And first of all, I want to say thank you for inviting me to speak on this platform. It is a privilege to be able to do so. And really, I thought I'd entitle this session as Midwifery Education During COVID, Dismantling Inequalities, Leaving No Student Behind. Before I start, I would like to thank my team at Southbank for the great teamwork and the great challenges we faced during this COVID-19 pandemic. You know, we are a supportive team, we are a small team, but I think we faced challenges very well, and also the student body and our practice partners. So moving on. First of all, I want to ask this question: are we all in the same race with COVID? The evidence shows that no one is immune from contracting the virus. That's quite obvious. However, the outcomes and the survival rates are really dependent on not just things that are in medical form, but it's also social, economic, political, and racial factors. These impact on a person's ability to overcome this virus and also to survive this pandemic. And so I'll call it a race in getting through this COVID-19 pandemic, which has obstacles, turns, and bends, which makes it difficult to compete equally. So first of all, I thought I'd get some background. Let's look at the international race. So what's happening in midwifery education in the greater environment worldwide? As we all know, equally with other healthcare education and university courses, lockdown measures has imposed great disadvantages to education, particularly midwifery education. And I know in some parts of the world, when the lockdown first started in March, and in some countries even earlier, some midwifery programs are actually closed, placements were lost for students. And unfortunately, midwifery students have to undertake placement in order to complete the course, otherwise they don't qualify. And then what was decided by some institutions, what they would do is that they would offer the theory component of the course on online platforms. However, one of the biggest issues or challenges with conducting midwifery programs in the COVID-19 pandemic is the placement element. It's unavoidable. Students have to undertake it, otherwise they will not qualify. If we look at what happened with the NMC in the UK, during the first lockdown, emergency standards were put into place. And this in particular enabled students in the final 6 months of their training to complete their training in practice. With the second year students, they were allowed to continue in practice with an 80-20% practice theory component. So that removed the 50-50 theory practice component required by the NMC. For the first year midwifery students, unfortunately, these students had only been in placement or on the course for about 6 months. And so they were removed completely from the practice area, and the rest of the year was completed in theory block. And for the whole of the midwifery program, it was decided that we would deliver, and also because of social distancing, the theoretical instruction would be replaced with distant learning. Now, since the end of September, the recovery standards produced by the NMC has allowed us to more or less revert back to conditions prior to the lockdown. However, as I think in most universities, the theoretical instruction has continued to be replaced with distant learning, blended learning, remote learning, because of course there's no face-to-face learning recommended because of the pandemic. Now, if we look at Health Education England, they tried to even out the race further. And this was allowing students during the first lockdown to have a paid placement role, and therefore second-year students, third-year students in the first 6 months of their training, and students on the shortened program, they were allowed to have paid placement role, and this would include working as a HCA. But losing the supernumerary status, but obviously having the supervision and support that they required. And students were allowed to opt in or opt out of this. And of course, we're going to go through the many reasons why students did decide to opt out. So before I go any further, let's look at inequalities before the race even started. We know that in higher education institutes, there was already, I like to call it an ethnicity, not a BAME attainment gap, because obviously there's a lot of issues with the word or the term BAME, resulting in people feeling there's a loss of identity, and that using that kind of term loses people's identity. So there was an attainment gap of 13% between people from particular ethnic groups and white British groups, of about 13% for first class or upper second class degrees. There was already a high dropout rate for students from particular backgrounds. There was complaints about Eurocentric curriculums and lack of awareness of issues affecting students from different ethnic backgrounds in undertaking higher education. And when we look at academic staff, there was inequalities in pay and promotion for academic staff relating to their demographic, lack of diversity in academic staff, and unconscious bias was also an issue. And the term unconscious bias, it means different things to different people, but basically it's about stereotyping unconsciously. So if you meet someone who you've met before from a particular culture, country, with a particular accent, the attributes that you put to that person, you would apply it to the same person with the similar characteristics. So that's the simplest way of saying unconscious bias. And then within higher education institutes, there was lack of senior leadership from ethnic minority groups. And this was important, an important fact to consider, because if you have a diverse student body, but when you look at their academic staff and they are not diverse, then what does that reflect to students who are studying on the course? How do you think they feel when they see, right, there's no one that looks like me teaching me this course? Do they really understand what I'm going through? And am I able to be transparent with those people about how I'm feeling? If you go to the NHS, similar issues, but in this case, likelihood of midwives from particular demographics to undergo disciplinary procedures locally, likelihood for these people to be referred to the NMC, cultures of bullying and harassment, organizational culture of discrimination and racism, again, unconscious bias, stereotyping unconsciously, lack of senior leadership from ethnic groups. Now, there's been lots and lots of issues around, we need to tackle this. Lots of organizations developed to tackle this. But we know that at the start of the COVID-19 pandemic, these were issues that we were dealing with already. So let's look at the impact of COVID on training for student midwives. First of all, and this affected me personally, the lockdown resulted in formal and informal networks of childcare disappearing almost overnight. Households were left to absorb care needs. And this particularly affected low-income houses, women, single parents, students maybe with underlying disabilities, and essential workers. Now we know that the schools were kept open for essential workers, but people didn't want to send their children to school regardless, because the fear of contracting this virus was out there. And also, if they had someone in the house that was vulnerable or needed shielding, you weren't going to send your children out. So this is what students were dealing with. And we know that the majority of the midwifery student population are women, and women are inherently normally the carers. So it's not just young children, elderly relatives as well. Now we know that students tend to take on jobs to supplement their loans. And during the lockdown, 34% of students lost a job, or basically we know that they tend to get jobs in retail and hospitality sectors. That more or less went overnight as well. And then if students were relying on families to support them, if those families were also employed in those similar sectors, that would be an issue as well in getting financial support from those areas. Now, there has been a prospective cohort study done by UK University around mental well-being of students during COVID-19, and it's demonstrated that there have been impaired and perceived stress increased during the pandemic. And this is around loss of support bubbles, students being isolated, not having peer support, not seeing their family members. And we know that before even the COVID-19 pandemic, there was a fivefold increase on students, first-year students reporting mental health stress, and 94% of higher education institutes had already seen a rise in demand for counselling services. So that was the impact of COVID. Now, ethnicity, training amongst risk. Public Health England, and I'm sure we've all seen this report before, found quite early on that COVID-19 was diagnosed higher in Black ethnic groups. People from Bangladeshi groups, despite their sex, age, area, region, had a 50% risk of dying, or tries the risk of dying, compared to people of white British ethnic groups. And we know that people from other ethnicities had between a 10 to 50% risk of death when compared to white British groups. And one of the things that came out from the Public Health England review, which I was pleased to see, was they believed that historic racism and poor experiences of healthcare services impacted on people engaging with services. And people who worked in healthcare services, so that's our NHS staff mainly, were fearful of speaking up when they had concerns about PPE or any risks, which would increase the risk of contracting COVID-19. So what does it mean to our student midwifery body? Placements, race into the unknown. It's unavoidable to have to do the placement. Whether they did it, continue to stay in placement at the start of the first lockdown, and that meant that students would be disadvantaged if they couldn't opt in because of other personal reasons. And those students who were delayed going into practice because of trying to organise how they would go into placement, it was an issue. It's unavoidable placement. It's an NMC and EU requirement. So students have to face the risk of, having ill health, contracting the virus. The stats are out there. We need to think about the impact of COVID on the NHS midwifery and nursing workforce. If midwives are stressed to supervise this, then that would impact on the student body as well. It's unavoidable. If midwives are stressed and they're having to, look after women and maybe deal with COVID patients, it's going to impact on the students that they are supervising. And then we have to think about the institutional racism and unconscious bias and an impact on the health of midwives. We do know that racism increases stress levels, and that's a fact. And we know that pregnant women, as Sue had already said, the risks of you dying in pregnancy is 5 times in Black women. It's 3 times in mixed race women and 2 times in Asian women compared to white British women. So it is an issue. So how do you overcome the hurdles in midwifery training? Well, first of all, we need to acknowledge this lack of strong leadership with a commitment to removing inequalities. And there needs to be open discussions about discrimination and race. That is not really present within midwifery training. It should be part of the curriculum. And if your curriculum is also not racially diverse or inclusive, that can be a problem as well. And then on the last point, we're not getting the evidence that we need in order to address the needs that students come into midwifery training with and the ongoing needs they have during the training program. During COVID-19, as I said, we more or less went to online teaching overnight. Now, I did read somewhere, and this is from an Open University lecturer, the skill of teaching online is a skill that can't be learned overnight. It's something that takes years to perfect, but we were having to do that almost immediately. So adapting the curriculum into an online format was really, really difficult. So online teaching, pre-recorded sessions, and I tell you, to pre-record a presentation takes ages, particularly if you're like me and I keep fumbling at every third or fourth slide and have to go back. It's almost a nightmare. And then also, devising teaching that is student-led and motivating enough to allow students to want to engage with the student-led learning. And then obviously teaching with methods that recognise diversity and encourage inclusivity. And it's about, looking at the student you are teaching to and recognising that they may come from a different background and trying to embrace that, because that was what piques students' interest. We also have to acknowledge students' learning styles. We know that students, some are visual learners, some are auditory learners, and some are kinesthetic learners. And so making sure that there's a variety of learning delivery methods so that we do address students' learning styles. And then, of course, making unbiased and fair assessments. And of course, all our assessments now are online. So our OSCEs, our face-to-face OSCEs, which were normally demonstrating a skill, that's going to be done online. And, not everyone is really good at using the computer. It's a skill that they had to learn. We don't tend to be, I'm on the computer sometimes 6 to 8 hours in a day, and that's normally not what I would normally do, but it's unavoidable now. This is the world we're living in. But I do say to students, you are very lucky now, because when I was training, we didn't have the world at our fingertips. When you want to find a piece of research or paper, you can just click the keyboard and find it. I had to physically go down to the RCN library. It was a day job, a whole day shift. So take my packed lunch, take my water, my money for my photocopier, and be there for the whole day, going through all the journals and getting my material for my next assessment. So in that way, we are lucky that this COVID-19, if we're lucky at all to have it at all, has come in this day and age where there is the technology. So continuing to stay in the race, continuing to train. Technical preparation of students, very important. Making sure they are prepared, so making sure that there's learning for students and acknowledging that we have a diverse world and not everyone would learn and, embrace technology in the same way. I mean, it's very different if you're very good on your phone, but when you have to, look at programs and software and hardware, it can be a little bit overwhelming. And obviously, when we're teaching, and the platform we use at LSBU is MS Teams, the amount of things that can go wrong with that platform is unbelievable. And then technical preparation of lecturers. And I'm talking about myself. I mean, some of my colleagues have done much better, but it has been a steep learning curve to get used to the software and get used to all the things that my computer can do. And leading on from that, you have to have appropriate computer hardware, software, and a really good broadband connection. And I know that in our university, students were allowed to apply for hardship funds to apply computer equipment and any other equipment they thought that they would need, because obviously it is expensive to have to go out and buy a computer at the drop of a hat when you haven't, expected to. And then motivation to learn online is very important. Acknowledging the demands on the students and the relevance of the contents, and just being aware that students have to have an appropriate learning environment. And if it's in their homes, being aware that there may be other things in the home that's impacting on the learning. There may be people in the house, there may be other pressures on the time which is not related to the course, which they still have to pay attention to. And just be aware of unconscious bias, discrimination and racism. So addressing inequalities, let's make it a fair race. Zero tolerance of discrimination and racism, making sure we have those open discussions, it's important within university settings. Exploring students' perceptions and experiences. Risk assessment, which should be culturally safe. And I know that Public Health England talked about culturally competent, but culturally safe, letting the student decide what is culturally appropriate, not you. Health education, which is culturally safe as well. Being aware of mental and well-being of students, acknowledging their socio-economic pressures, pastoral support, practice support, theoretical support, and digital support, all very important. So I'm going to end it there and look at training in the future. Now, the Commission on Raising of Ethnic Disparities has asked the government to look at ethnic disparities, and one of the focuses is on education. And there's a survey going on which ends at the end of November. And also, NET's National Education and Training Survey is particularly looking at health education students. I'll ask them to, go into this survey and answer questions about their experiences of learning. So thank you, I end it there.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.